Good morning and welcome to the 2020 Michigan County's virtual annual conference. I am Derek Milo, Director of Communications and Marketing for MAC, and I'm speaking to you today from our main conference room here at the MAC headquarters in Lansing, and I'll be your moderator for our first conference event, which is a workshop on developing long-term strategies for your facilities in a COVID-19 world. The workshop today will focus on best practices, lessons learned, innovative techniques, and new equipment that MAC members may want to consider for their facilities. Our speakers today will be Terry Van Doren of MMRMA, which is one of our conference sponsors, so we appreciate their support. And Terry will be participating today with Gary Knotts, who is Facility Manager for the City of Rochester Hills. Terry and Gary will be engaging in a Q&A format with each other today, so be ready for that. And then a few notes before we do get started. For those of you out in the virtual audience, we will be taking questions at the end of their presentation. So as you come up with a question, type it into the question field of your Zoom portal, and we will be reading the questions to Terry and Gary at the end of their presentation. This session should last about an hour, and then we'll segue into our first plenary session of the conference. The event is being recorded and will be posted to the MAC website at some point in the month of September. So with that, I would like to welcome Terry and Gary to our conference.
Today we are going to conduct an interview kind of a session where I'm going to be the interviewer and Gary's going to be our expert. And we're going to kind of run through the session like that. Gary is a FMP certified facility manager for the City of Rochester Hills. The City of Rochester Hills is a community with a population of 52,000 and over 250 employees. Like it was mentioned before, the training today will be similar to an interview. I will be asking Gary questions and our expert Gary will be commenting. Let's go to slide 2. Gary.
Yes, sir.
You're up.
The COVID pandemic has changed the manner in which organizations manage facilities, why information is, and how information is addressed to the virus continues to evolve. Some of the lessons I've learned and my team here at the City of Rochester Hills is, number one, not to panic, and number two, we're constantly changing daily with information that comes out. Some of the societal lessons we learned, beyond the loss of life, COVID-19 has altered societal habits as we increasingly rely on means to which to decrease social contacts. Grocery store delivery and pickup service replace store visits. Virtual meetings like this one instead of in-person meetings. Virtual education blended with traditional learning. And more of us have been working from home, has become more common.
Hey, Gary, we've had a number of discussions recently in regards to COVID and facilities. What are some lessons you have learned in facilities management during the COVID-19 pandemic?
Like I said, first of all, not to panic. We closely monitor the CDC guidelines. We watch the news. We check with Oakland County for their updates. The city has updates as well. And some of the lessons we've learned how to flatten the curve as a society is we've closed borders and work locations to prevent the spread of the disease. Wash your hands like mom told you to prevent the spread of the disease. Social distancing to slow the spread of the disease. Wearing a mask to slow the spread of the disease to protect you and others with whom you come in contact. Testing to monitor for COVID-19. And aggressive vaccine development to treat, cure, and prevent the disease.
Now, Gary, did you close any city work locations during the pandemic?
Yeah, we closed all the city locations where there was only a couple people We had a couple people working at our DPS building just in case there's an emergency came up. And then I was here at City Hall and a member of my team just in case anything came up that we needed to address or handle. And then we still had to do the, make sure the equipment was being inspected and checked and perform our maintenance on it daily that was required.
Gary, did you keep any locations open?
Just the fire stations in the Oakland County Sheriff's Department.
Okay. Now, Gary, you mentioned wearing a mask. Did you provide masks for employees?
Yes, we initially, because of the job that Facilities does here at the City of Rochester Hills, we actually had some masks on hand. So we didn't have enough to supply all of City Hall if they were back to work, but our purchasing department worked tirelessly. And so when everybody was called back to work in June, we had enough masks and everything and PPE equipment to distribute to staff.
Okay. So what type of masks did you provide?
We have the surgical masks and we have the N95 masks. And we also have the face shields.
The face shields, so you use the face shields too?
Yes.
Okay. Gary, what resources did you use in addressing COVID-19?
Well, we use the Center for Disease Control. They provide guidelines on cleaning, and we had a big thing here where we have a lot of packages of mail that come in daily, and we have a drop box. So there wasn't really any clear direction when the whole pandemic started. So we were actually quarantining all our mail and packages coming in a room for 48 hours before we would distribute it to staff. So as the packages would come in, we were gloved and masked up, and then we would write the dates that we received them and the times. And then we'd wait 48 hours to distribute them. We still are. The CDC has since released some updates that they don't have a lot of proven evidence that the disease is transmitted through packages or mail at this point, but we're still taking all the precautions to be safe.
So Gary, you didn't have a room designated in the beginning for those packages, did you?
No, it was in the lobby, and now it's in our back receiving area.
Okay, so that's another thing that you have to consider when you're planning for a pandemic is actually what are you going to do with packages when you receive them?
Absolutely.
Gary, who was responsible for relaying the governor's executive orders to your employees?
That would be the mayor and then our directors. It would cascade down from the mayor to the city directors to the managers and from the managers to the employees.
And especially in our state, you had a staying updated on the ever-changing requirements. How often did you guys address those changes?
As they came up.
As they came up, yeah.
As something changed. And then we'd have in our department, we had daily Google Meets, just so, because the staff wasn't all here together. There was only like one or two of us in my department. So we actually used the Google Meets to keep everybody as like they were part of the office here, so they weren't left out of the loop or any of the communications. So we had those Google Meets and kept everybody up to speed on the changes and what was going on.
Gary, we have talked a little bit in the past about the IFMA. Can you tell us a little bit about it?
Yes, that's where my FMP comes from. I'm a facilities management professional. It's the International Facilities Management Association, and I'm a member. I've been a member for the past 3 years, and they offered the training to become an FMP. So it was 4 sections of a class, and I completed all 4 sections, and that's how I got the FMP designation. But,
and would you recommend this certification for other facility managers?
Yes, it's also where I was able to network with my peers as well as get loads of information on what other facility managers were doing around the world and around the country, and different products and different cleaning machines and different protocols. And it was just a great resource where people were openly sharing information to help one another out.
Yeah, absolutely. And just, I belong to a few associations too. And I know that the Michigan Recreation and Parks Association and the National Parks and Recreation Association was sharing COVID related information with their members. And so that was a great resource for me too, to be able to tap into, especially with the parks and recreation, a little bit different than the facilities. So now, what other resources, I mean, you guys shared information through the IFMA and your membership and through that association. What kind of COVID information did you guys share?
Disinfecting protocols, types of equipment, return to work guidelines, office shutdowns, social distancing, where to obtain PPE equipment, because you couldn't get sanitizer, paper towel, or toilet paper for a while there. Glass, everything was pretty limited. So
absolutely.
Fortunately, we were pretty stocked up, but now we keep an eye on our inventories, and we make sure that we're rotating our inventories of merchandise so nothing expires. So we're actually planning, because they said there's, the speculation is there's going to be a wave 2, and I think we're kind of in that wave 2 now across the country. So, we're making sure that we keep our stockpiles and remind people of the return to work protocols that we established here as a city, as a county, and as a state.
I know, just on a personal note, I was going through the Kroger store, my local Kroger store, and I noticed on the shelf for the first time that there was actually toilet paper, available to purchase. And I almost had a feeling like I needed to rush over there and buy 2 or 3, just because, the potential spike. But yeah, I get what you mean. Another great resource, especially for our members, is the Michigan Municipal Risk Management Authority, our Facilities Management Risk Control Advisory Committee, which Gary is the chair on, and also Cindy King, who's our Human Resources and Risk Control Department Director, put together a number of COVID-19 related resources. So if you belong to the program, you can always tap into those resources on our website. Gary, what about Oakland County? How did they assist?
Oakland County established some of the early protocols and followed some of the CD guidelines. So we kind of followed their lead on it. So we formulated a return to work committee here at the city of Rochester Hills, where all the city departments were represented, and we developed protocols and safety practices together as a group. So everybody had an equal voice and input. And we used all the information we've discussed to put those protocols and practices into place as well. Jumping ahead a little bit here, is I used YouTube and Google.
Yeah. How did you use them? That's really a question I had.
Just to see what different resources were out there, and materials, and Google searches for gloves and sanitizers and things like that, just as another resource to try to get as much information as I possibly could. Yeah,
and I think that's kind of unique, because I haven't talked to anyone else in the membership program for the MMRMA that was actually using Google or YouTube to research for that information. So that's kind of unique. I really think that's great.
But also our group is the MMRMA group that, we weren't able to meet in person. So just, having everybody's email information and things like that. And, I was able to reach out to, the different Southfield, Ingham County, all our different contacts in Traverse City, just to see what they were doing and ideas. And, everybody in our committee responds pretty quickly to these things, because we all want to help each other out. And like you said, we're getting best practices and information there on the fly. So trying to figure out how to do things. I reached out a couple times, because we have our city council dais, and I was trying to figure out what people were doing to separate the people sitting at the council dais. So, people shared some ideas how they were hanging sneeze guards from the ceiling and things like that. And I was able to find some, they were clear plastic pull-up displays that come up from the floor, like it would be a banner that you can pull it up. So we have our council members separated with actually banner displays that are clear plastic. They pull up on a pole. You secure them at the top. They're 68 inches, I believe, from the floor, and about 48 inches wide. That goes up to the countertop. And then on the countertop, I have some 24 in length by 28 inches high, so that each council member can sit there when they come back and don't have to worry about having contact across with anybody to their right or to their left.
Wow, that's some really good stuff. Innovative thinking too, Gary.
Yeah, we have a great purchasing department that helped me with that.
Gary, in facilities management, we discussed that communication is key. Can you elaborate?
Communication isn't key. Many organizations discovered their communications were inadequate and crisis management was non-existent. It's important to create a crisis management team to be prepared for whatever may come your way. Practice the plan with your team like a fire drill, so all know what part they play in that drill. Invest in technology. We already had some technology here with our MIS department, and that's when we went to the Google Meets and we went over to the Zoom meetings.
Mm-hmm.
Having technology in place helped many organizations, especially the city. Oh, sorry. Especially the city of Rochester Hills shift to remote.
When it says,
Hey,
Facilities
Gary,
and maintenance. Yes.
can I ask you a question?
Sure.
Hey, what challenges did you face in the beginning with communication to your employees when the pandemic first hit? What were some challenges you faced?
Well, with our facilities division, we actually, because we were rotating the guys' shifts.
Yeah.
We weren't all here, so the guys were told to, have their phones, just to make sure they answered them when the call, make sure they were charged, things like that, so that if an emergency or situation came up, they were ready to respond. So it was a little difficult not have everybody in the office, but that's why we set up the Google Meets led by our director, and then we would all talk, and then each of the divisions would have a chance to talk and address their needs. So also, with the Google Meets, I was able to set up Google meetings with my team going that way until we were all back here in the office together.
That's great. Well, how about contractors? How did you communicate? Because I mean, you still were maintaining facilities and you're still working and stuff. So how did you communicate with contractors?
That was through email and through my city phone, because I was one of the few that was here for a while by myself. So we coordinated that with, and then I'd have one or two facilities techs with me, depending on the time of day. So we would coordinate that together, where if a contractor had to come in and perform service, they would call our contact information, and then they would have to complete a screening, either with our one that we do online daily, or we printed a paper copy of that. And then we also required that they have a copy of their COVID-19 policy before we let them do any work in our city buildings.
Yeah, that's interesting. Hey, Gary, how about communication to the public? I mean, who was involved in your community trying to get the message out about what you guys were doing?
That would be the mayor's office and Rochester Hills TV and MIS through our internet and our webpage.
Okay, all right. Now, Gary, you mentioned something about technology and investment into it, but what role did technology have in your COVID response?
It was huge. Our building department was already shifting over to online plan review, where they could do everything online through the prints with the huge the huge TV screens and smart TVs. So they were able to start doing some virtual inspections. So actually an inspector wasn't there. The contractor supplied an iPad, and they would go through the stuff, and our inspectors would direct them what they wanted to look at.
So kind of a virtual inspection where your inspector is on the iPad and the individual is taking them through whatever they're inspecting as far as the facility goes.
Correct.
Interesting. Hey, what type of tech too? Was there anything, that you decided to use in your COVID response?
As far as technology?
Yeah, you mentioned any new technology, something with the HVAC, some UV, and
yeah, we've actually were in the process of getting quotes to install UV lighting on our HVA units, where the coils come in to disinfect germs in the air as it comes into the building.
Okay. And then Gary, how will our facilities and maintenance leaders prepare for a future pandemic?
Well, we're going to be the ones that are going to lead the return to the new normal. Brainstorm. We'll have to brainstorm what questions we'll ask. Are the buildings open yet? Are we cleaning and sanitizing measures in place? How do we evaluate cleaning and disinfecting being done sufficiently and effectively to protect everyone? Who's accountable and responsible for the cleanliness and the sanitation? If someone gets sick, what happens? So I'm accountable for about almost 100% of it.
Mm-hmm.
And HR is involved in, what if somebody gets sick, but we have cleaning protocols that are put into place if somebody should get sick or anything like that. So we are the new leaders of that, and I'm continuing to monitor CDC guidelines and the government web pages to see what the new guidelines are and what's being done.
So Gary, a question that I get periodically, and I'm sure you've dealt with that, disaffecting versus sanitizing. Can you elaborate a little bit on that?
Well, disinfectant's where you kill the germs. Sanitizing is where you're basically cleaning it to disinfect it.
Mm-hmm. And what either disaffecting or sanitizing are you doing more of?
We wash the counters down with soap and water. We clean all our touch points with Clorox wipes
Mm-hmm.
to disinfect. But before we even do that, we wipe them down with soap and water. Then the guys come back and hit it with the disinfecting. We also have a couple of Clorox 360 disinfecting machines that will go in after hours and spray areas of the building to disinfect.
Okay. Gary, what are some issues with the work area / your environment that you had to deal with?
Sick employees must stay home. People come first for the safety of all of us. Business interruption and continuity comes second. Some infections will never go away. It must be maintained.
So let me ask you a question on that then, Gary. What functions are not critical in your business?
Well, painting a wall,
Good point. Yeah.
replacing drywall, things like that. We've maintained all the heavy duty expensive equipment, HVAC units, lighting, emergency backup generators, UPS batteries. We supported the fire department to make sure all their stuff was up and running correctly, and the Oakland County Sheriff's Office, because they have a remote office in the city of Rochester Hills. So those were our first responders. So we had to make sure that we were supporting them in every way possible to make sure all their stuff was operational.
Okay. And now what jobs are not conducive to remote work?
Most of my facilities work.
Okay. Can you describe some of that facility's work for us?
Well, facilities, for us to perform our work, we have to be in the buildings. So if we can't be in the buildings, it's a little difficult for us to do our work from a laptop.
Mm-hmm.
So it was great to catch up on our online trainings, things like that. And then some of our electrical training classes and HVAC training classes went remotely virtual. So that's how we were able to do some of that. But you need the hands-on work and, somebody teaching the teacher and then the student teaching the teacher back to make sure that they have the grasp of what they were learning. So most of our work.
Yeah. So that's why you had all hands on deck, because in your business, you can't do anything really from the laptop or virtual other than training.
Correct.
Or having meetings for communication with staff. So
Right.
really your type of work, you have to figure out a way to be able to be on site and take care of it. So interesting. Now, what level are you staffed at during the pandemic? Did you bring in everybody working or what?
From the middle of March till about the end of the last week of April, we were on a rotating shift with our facility staff. Mm-hmm. And then after the 27th, we brought our entire staff back on.
Okay.
We were getting the buildings propped and ready for the opening at the time that was slated for June 15th.
And then when you start to bring those employees back, are you doing some training with them in regards to COVID-19, like PPE and what to properly sanitize? Is that something that you're going through?
Yes, we all city employees were trained on how to properly put on gloves, wear a mask, do the self-checks, mm-hmm. Everything like that, disinfect. We did training with my staff in particular to clean, sanitize, and disinfect areas. So we pretty much followed the CDC guidelines and went through a training with my team. And then we identified certain areas of the building that common areas and things like that we clean to prevent this diseases. And we do that 3 or 4 times daily, as well as cleaning our restrooms.
Okay, and something that we've discussed, and I've gotten some questions from our members too, is your PPE policy really didn't address COVID. And so that was something that a number of our members had to update their PPE policy. Can you comment on that?
Yeah, so, the PPE protective equipment was for, like if you're on a ladder or a scaffolding, what type of, you have to have a harness and things like that. Or if you're in a confined space, the procedures you have to follow. Or if you're on a ladder, there's certain protocols you have to follow with that. And then if you're, we didn't have anything per se with masks. We were only wearing masks like if we were in an area with high dust or working with some industrial chemicals that were required to wear that with the SDS sheets and requirements, work with various chemicals and supplies. So we had to pretty much follow the COVID thing about wearing gloves and masks and things to that, and coming up with the, when to wear, when do we wear a shield and things like that.
Absolutely. So you had to do job assessments then and update some of those job assessments to then comply with the COVID requirements for PPE. And so that's something that counties and cities and governmental entities will have to look at in regards to that. Then you also have to train. One thing that I did have a conversation with someone else was the fact that if you make it mandatory that you are going to wear an N95 mask, that you must then fit test that employee for that mask. So I thought that was quite interesting, just like a firefighter getting fit tested for their, for their air breathing mask, their SCBA. I thought it was interesting that if you made it mandatory in your PPE for N95 mask, that you had to then fit test for it. So
yes.
Just something else to be aware of, I guess. And another thing we discussed, Gary, was the emergency response plan. And I hadn't heard that from anybody else but you. And so in regards to COVID-19.
Well, we have an emergency response plan for like if we lost power or there was a tornado or what, something, the worst happened in one of our buildings. So we just kind of took that, we called it an EPP, Emergency Preparedness Plan. So we kind of took what we had from that and kind of flipped it into a COVID-19 plan. And then that's how we assessed our return to work needs. And like we just discussed about, what happens and who's responsible for cleaning the buildings, disinfecting, or who's in charge of getting those products, and who's in charge if there is a case where somebody's not feeling well, who addresses and takes care of that area. So that's what we sorted through as a city, and we put together our return to work policies and guidelines.
Okay. Gary, I know that your city hall was built during a time when the open floor concept was really popular.
Yes.
So what issues or risks are you dealing with now that we have COVID with this open floor plan?
Well, it is an open floor plan. It's 2 stories. We have a nice inviting lobby and terrarium where there's different displays. We have a reference center where visitors can come in and check out the reference library where there's different things, or sit in there and read. So one of the things that we were concerned about is how we're going to take care of it all and make sure it's maintained. So we have at our front, where you come into any part of City Hall, we have disinfecting station set up, and a mask station set up, and a glove station set up, where if you need to grab you have to grab a mask first of all to come in. Some people like to grab the gloves, and we have those gloves available. And we check the disinfecting machines daily to make sure they're stocked, and we have strategically positioned trash cans that you can open up with your foot to dispose of those masks and gloves, and those are handled and emptied daily. So one of the biggest challenges we had was, how do we manage where people go? So like if you go to our building department, we have a counter. All of them have a counter. Not all of them have it, but they have an open area you can walk through. So we put up those, I can't remember what they're called, but they're like the pole ropes. And they're flat.
Mm-hmm.
So we put those up so nobody can walk behind city into the city departments. We also have sneeze guards at all the counters. And in between those sneeze guards, we were finding that people wanted to go in between them instead of standing
Right.
behind the plastic shield. So what we did is we had these little tables that we put up, 4x4 tables that we put there to protect so nobody would walk between them. But since then, we were able to order the lobby stanchions, and we created a triangle effect that blocks people from going in between the sneeze guards at all the city counters. So we just finished installing those today. So that was the area just to make sure that people were flowing. You know, we put down the 6-foot markings on the floor, installed signage everywhere about social distancing, washing your hands, you know, people in the restroom, you know, make sure you're keeping social distance, how to open a restroom door, how to, and just all sorts of different protocols on how to be safe. We have a lot of signage all posted up throughout City Hall, but it's not overbearing, but it's to the point where we can keep anybody coming into the city of Rochester Hills safe.
So Gary, with all that extra pieces of equipment and signs and stickers, I mean, did you have fundage for that? I mean, was there funds available? I mean, how did you deal with the cost to you know, manage COVID?
Our fiscal department, first of all, we plan conservatively as a city. So we have a fund for janitorial. So basically all those monies were coming out of our janitorial contract that was just recently renewed. So we actually had some money in that account. And then our directors, and my director and specifically myself, will work with the city controller, fiscal, and they'll manage. So we immediately cut monies we were going to spend on capital projects and improvements. So we work together with them to allocate funds to purchase certain things. And then we're keeping track of everything that we spent COVID-19 related in hopes of being able to get those funds back.
So Gary, what was your most expensive piece of equipment that you had to purchase in regards to COVID?
The Clorox sanitizing machines and all the sneeze guards. And
How much were those machines, Gary?
they're $4,000 a piece.
Yeah.
We got three, and we purchased 3 of them.
3 of them?
Yes.
So the costs can start to go astronomical. I mean, it can just keep climbing, you know, when you start to really get into it. Disaffecting, sanitizing, sneeze guards, PPE, you know, pieces of equipment to disinfect. I mean, it just seems to just go on and on and on. So one of the things that you could relay to the group today is that you need to financially plan, have a plan for in the future if there is a pandemic, being able to get supplies, get materials, and what you need to do to be able to combat it. So I think it's really important. Hey, Gary, we did talk a little bit and about common areas. Can you describe what you mean by common areas?
Common area is a place where the public and employees can access.
Okay. So, and that's something that you really want to identify ahead of time as a part of your disinfecting and sanitizing program, and make sure you put that into your protocol to take care of that.
Absolutely.
Absolutely. And then you did mention a little bit about setting aside funds and supplies and other potentials and developing our emergency preparedness plan. We did talk about that and updating that. But who should be involved in pre-planning for a COVID or a pandemic event in your community?
All of us. I was myself purchasing. We had you know, when it happened, we had some emergency plans and prepared for other things. We kind of, like I said, we kind of just took what we could from each of those and combined them into our one for COVID. But when we would put our return to work guidelines together, we got all the departments had an equal voice, because I don't perform purchasing's job. I don't perform DPS's job. I don't perform HR's job. I don't perform the mayor's job. So we integrated all the different people from all the different departments, so everybody had a voice, so we weren't missing somebody. And then before we went through many drafts, and before anything got finalized or put into the final draft of our return to work policy, it was agreed upon by all parties.
Okay, so it's very important that then there's a representation across the board with all the departments, and they're a part of that plan. All right, Gary, what should the facilities community be considering for return to work guidelines?
People preparedness, our work environment, an exposure event, visitor policy, travel policy, cleaning guidelines, and scope.
Can you tell me a little bit, just a little bit about each one of those bullet points?
Well, people preparedness is be prepared for people to come back to work and be prepared for people to come into your building. Our work environment, the environment in which you work, City Hall, the fire stations, and the sheriff station, parks are all a little bit different. So know your buildings and what you'd have to prepare for people entering those. An exposure event, what if somebody was exposed to the COVID-19? How do you handle that? Some other cities were setting up rooms to isolate them in, things like that. Well, if you move one person from a desk to another room, you're kind of creating a double amount of work there with the exposure. So if somebody's exposed here or isn't feeling well, they're sent home for the day. And then we're notified of the area, not of the person, but of the area that we need to treat as soon as we possibly can that day. So we'll go in and treat that area. Your visitor policy is how are visitors allowed to come into your building? Mm-hmm. So, some cities restricted hours, some cities haven't opened up at all. Our travel policy is none of us are allowed to travel through the city. We don't travel to trainings. We don't do any traveling. So that's our travel policy. And then our cleaning guidelines are the guidelines and scope that we set up, how we're cleaning and maintaining the buildings, cleaning, disinfecting, and sanitizing the buildings. So that's when we got the Clorox 360 machines. We incorporated that into our cleaning, worked with our cleaning contractor to make sure that we were on the same page of what areas and touch points we're hitting. So we really walked through we had a really good cleaning plan in place to begin with. So we just expanded on that and included a lot of touch points and increased the levels of times that we're cleaning the building. Plus, with facilities, we see people in the building all day. We can tell which areas is a lot more busy. Like during elections, mm-hmm. I dedicated staff just to, because we opened up City Hall. We closed City Hall, but opened it up for people voting mm-hmm. and getting their absentee ballots filled out and registering to vote. So we had that all set up on our first floor. So I had dedicated staff just to keep cleaning and working that area.
Great. So Gary, would you say then you were kind of the epic center for all your other departments? I mean, did you have departments coming to you and saying, hey, what should I be doing about my building or facility?
Yeah, we had a lot of them when City Hall was closed from March to January, and people were working remotely. I mean, we were called to, look for packages, turn on computer desktops, water plants. I mean, anything and everything. We were the go-to for anything that people couldn't do remotely. So we just do the best we can to help every department out and support them, because every department, everybody's our customer. So we just wanted to make sure we were taking care of everybody.
Mm-hmm. When you were discussing people preparedness, you mentioned before something about alignment. What do you mean by alignment?
Well, alignment means, just like I talked about with all the departments being represented. It's basically what we did. It's needed at all levels. And I wrote here in my little draft here, we'll have to hold hands and pivot with the situation where we all have a voice, we work together, and then as it changes, make those changes collectively and correctly. Mm-hmm. Guidelines for returning to work. must be developed with HR. HR was involved with it in our legal review from our city attorney. The mayor's office communicated to the community as well as Rochester Hills TV and our MIS department to the internet.
Mhm.
We defined what was needed from each employee, requirements for returning, exposure protocol, restricted home, screening questions and implementation. The new normal workday consists of this: self-monitoring, physically well, mentally prepared for returning to work. We have entry and exit procedures. We have an employee entrance that people come in, and then we have the visitor entrance. Employees are allowed to come to either door. And like I said, we have the sanitation stations there, as well as the masks and gloves. When we have meetings, council meetings, even though they're done through Zoom, people are still allowed to come to City Hall. So we have people, remember my staff manage the doors because the doors are locked. So if somebody wants to come in, they're allowed to come in. We only have 17 seats in our auditorium right now because of the social distancing.
Mhm.
People are required to take their temperatures. We have temperature guns if so required to check temperatures. If somebody says they're not feeling well. And then we staggered work for a while, just probably a couple weeks ago with our own department, because we have cubicles and we didn't have the social distancing there. So just recently my cubicle sneeze guards came in. So I actually have cubicle sneeze guards that are able to be placed right onto the cubicle, that snap into the cubicle, and then the shield snaps into that, and then they have the protective plexiglass screen. So those just came in.
Wow. Yeah, that's unique.
So we're able to have our complete staff back here for the building department, and then working with purchasing in the early going of what the PPE was required, and then like we discussed already, the mask and the type.
Yeah, we did talk about updating the PP policy. So a little more specific, how did you keep your community engaged and empowered?
The mayor's office handled all those communications along with Rochester Hills TV and the MIS department through the internet and websites. So I wasn't really too involved with that, other than from the facilities perspective, I posted signs throughout City Hall and on the lawn that we're all heroes and essential workers. Thank you. And, we're in this together and things like that, we put out on our front lawn here at City Hall and throughout the city buildings and our parks locations. That was handled through the other departments more than me.
Okay. Gary, can you describe areas where people work and collaborate? Can you kind of give us some ideas there that what you're talking about?
Yeah, we kind of just touched on that. So if I have we have cubicles set up in 4s, 6s, and the people are close together. So we measured them. If people were within 6 feet, that's when we got the cubicle mounted sneeze guards to make sure that those were there to separate the people. And then areas where people work and collaborate is basically the auditorium for City Hall events, or we have meetings in there too, and planning meetings, or we have various conference rooms that people get together to have a meeting. So everything is tagged. There's only a certain amount of chairs in each conference room, and it's actually tagged on the tables of where people are allowed to sit. And then in our auditorium, we've closed off seats, and those are actually tagged which ones you're allowed to sit in. And in our reference resource library downstairs, we remove chairs and tables from everywhere just to make sure everybody has an area where it's safe and over 6 feet in distance. We have an employee break area / lunchroom where we had to remove chairs and space tables. So and to go back, the common areas like we touched on, we had to make sure everything was socially distanced, 6 feet apart by 6 feet by 6 feet. Huddle rooms are rooms just like a conference room, and I've seen them in other cities and other buildings that I've had the opportunity to tour. They're a room and the ones I've seen are just all glass encased, where it's a room where one or two people can sit or talk, or it's a room where one person can go in there to take a private phone call. So I know
Okay.
some people were struggling. Do they keep them open at all versus closing them? And then we had the staged return versus the mass return. So we had people, like I just talked on briefly in the last slide, where people were working remotely from home,
Mhm.
and other people were, and we were staggering those shifts. So one person might work Monday, Tuesday, and Wednesday from here. The next one might work Tuesday and Thursday, and then it rotates. And then working shifts, we had some people coming in that worked early in the morning and left, and then we had some people that come in later in the day with some of my facilities techs. So we kind of staggered the shifts. So,
And Gary, you said you're working 16-hour shifts?
well, we have a shift that goes from 7 to 3:30, another one that goes from 3:30 to 11 at night. So we didn't have anybody working 16 hours with just the shift staggering.
Good, good. Okay. Gary, what issues are facility managers facing in the work environment?
Well, it's building preparation, and a lot of this we kind of touched on through our prior discussions and questions and answers here from you and me here just briefly. So the biggest thing is sanitizing, cleaning, disinfecting attended areas. In the early going, it was making sure we had enough wipes, sanitizer, and soap readily available. It was a little touch and go, but we're in good shape here now. The AC and filter maintenance program, we do our filters every three to 4 months. So we were in good shape with the filters, with that and our AC, and we didn't need our AC at that time because it was March. But we increased our HVAC ventilation rates for airflow. And then we're currently right now getting UV lighting pricing to be installed to kill germs as they enter the HVAC coils as they enter the buildings.
Hey, Gary, no,
Yeah.
why did you increase your airflow? What's the advantage?
The advantage was that the viruses and germs wouldn't be hanging around in the airflow for as long as amount of time. And that was actually being in the building department. I have access to mechanical, plumbing, electrical, and building inspectors all day long. So immediately we reached out to a resource we had in-house, my mechanical inspector, and it was based on his recommendation that we increase the ventilation rates.
Okay.
We try to do a lot of things in-house because I have a lot of experts here at the city, so I try to take advantage of them when I can. So this was definitely one of those things where it was all hands on deck, so I reached out to all of them. And then,
in your next 3 bullet points, if I was thinking about a building, I wouldn't think about that, but these are also important. Could you describe?
Yeah, the lighting configuration, everything turned off is back on. We had water fountains that we, because of the executive order from the governor, we shut the water flows off to them. We had coffee pots that were in the building that nobody used that had to be flushed, cleaned, sanitized, and disinfected. We had countertops that needed to be cleaned. The ice machines were emptied, refilled, and those are set up on they will tell us when they need to be cleaned, but we also have a computer program, a facilities management program that'll tell us when we need to clean them. We change our focus on our cleaning protocols. Now we're doing it, before we'd be doing it once, maybe twice a day. Now we're doing it 3, 4, 5, 6, 7 times a day based on, let's say there was a meeting in conference room 221. So after the conference room's done, a lot of the people will clean it, but we'll go back in there because every employee is responsible for cleaning their own workstation. So, just as a safety measure, if somebody's in a conference room, they're required to clean it up and wipe it down. But we come in behind them and wipe it down and clean it as well. And then our cleaning schedules, just touched on that, about how we had to change and alter those. And then I also just touched back about after meetings. So when we had the elections here at City Hall and all the different things, immediately that next day, in that night, they didn't get out of here until about 12:30, 2 o'clock in the morning. So my tech was already here, so he disinfected. And then when we came in early, he disinfected all those areas with the Clorox 360 machines and wiped all the touch points and tables and everything that could be a potential risk. We took care of all those areas and wiped them down and disinfecting them so people coming in that day could feel safe and secure.
Gary, in the work environment, what specific issues do you face with facilities and buildings?
Maintaining proper distances. There's a lot of people that can't or don't want to follow the social distancing protocols. Where they're 6 feet apart. Like I said, we had the sneeze guards where people could walk. They're 6 feet apart where people could walk between them. So instead of just standing instead of the plastic shield like you were at a teller, they were going in between it. So we had to remind people. So then we had to go a step further, and that's when we put those stanchions with the ropes up to make sure people weren't standing through those. And then, we had to make sure that, people are wearing their masks, and if they don't have a mask, we ask them to politely put on a mask. The sneeze guards at the counters, we made sure that all the sneeze guards are properly, we have enough at all the counters to protect any of our customers and staff that come into the building. We had to ramp up services for the full return, so that's why my facility staff was here about a month before we had a full return to work. Eating shifts in lunchrooms, people can take their lunch at various times, so that really hasn't been an issue. Plus, like with the warm weather, a lot of people like to go outside and eat because we have a beautiful landscape here at the City of Rochester Hills with walking trails and the Clinton River right behind me here. So a lot of people will go out on a bench there or go to one of our parks to have lunch, so that's not really an issue. We do have an elevator, and to be safe, socially distanced at this point, we can only fit 2 people in there. So we have a diverse crowd of people that come in here of all different ages that use the elevator. So it's important that we sanitize that. So that's increased how often we clean all the touch points in an elevator and wipe the doors and the walls down. And that kind of goes right into the next point with the cleaning, sanitation, and frequencies. All the frequencies have been increased.
How about your visitor policy?
Well, any vendor that comes into the building, I have to have a copy, and my staff has to have a copy of their COVID-19 policies and procedures. And then they have to fill out one of our daily screenings. Either we have it where they can do it right from their phone, the QR code, and we have it where we can give it to them physically on paper, or we can send them the city email to do it. So we make sure that it's being filled out one of the 3 ways, and that is sent to my support staff before they're allowed to enter. That's confirmed. When it's been confirmed, they're allowed to enter the building, and most of the time we have it sent to them a couple days ahead of time because we know who's coming in and out of the building because we manage that. So they'll have that ahead of time unless it's an emergency. And then visitors who enter our buildings are asked to do the same thing. And then personal visitors do the same thing. There is no limitations. And then limitations to movement or building access, that's limited by all the different signage and control ropes we have. And then right now, we're not having any homeowners meetings or anything like that at City Hall. That's all been put on hold for because of the COVID-19. And all our city council meetings right now are held remotely through Zoom. And we had a meeting, we did our budget presentations, and it was controlled or limited who could go into the auditorium to make the presentation. So we staggered it. So we were all scheduled at certain times. We'd go in. So to protect everybody and their safety and the mask requirement.
Gary, a major issue for facilities managers is cleaning guidelines. What is the typical scope of work?
Provide a direct surface contact cleaning services using CDC and EPA approved supplies. offering bacterial, germicidal, and several agents to disinfect and reduce the risks from contact-based pathogens. This is to target specific high touch point areas. Like we have a first and second floors, so my elevator is a high touch point area. Also, I have stairwells with handrails throughout the building. That's a high touch point area. So anything where multiple people could be touching it a day, whether they touch it or not, we're hitting it.
Okay.
Disinfectant services, a sample policy summary, using proper EPA registered products, and there's a list of those on the CDC website, designated specifically for disinfection efforts. We are disinfecting the foul areas and surface. Some people do it over the weekend. We do it daily, and doing after hours approved by management. These are specific to designated floors. So I assign floors and areas nightly that have to be done, and my team and my cleaning staff will carry that out. Designated areas to be serviced, same thing. We have all areas, any touch point, all surfaces. We have a kitchen area / break area, tables, surfaces, arms of chairs, except fabric coverings, handles, touch pads. We have microwaves. We have a refrigerator. We have an ice machine. We have a Coke machine. We have another vending machine with snacks in it. So we make sure we're hitting all the areas.
Okay. And here you have used these and other similar types of EPA and CDC approved products.
Yeah, these are just some of the ones. I only listed a few. There's a whole lot out there. The TB quandary, I was able to, when everything kind of hit the fan and people were having a tough time getting Clorox wipes and things like that, we get this TB side quat cleaner, and that's that TB quandary bolt disinfectant. That works absolutely fantastic. I was able to, comes in gallon and quart jugs, and I was able to procure about 15-20 cases, and our parks department and my team absolutely love it for cleaning services. You got to watch what you use it on.
Sure.
But my team, I've got nothing but positive feedback on it.
Okay. This slide right here is from the MMRMA. This is from our COVID-19 resources and a sample employee entry screening questionnaire. In order for the access to the office, I affirm I do not have a fever, 100 degrees F or 37.8 degrees C, cough, shortness of breath, sore throat. I've had no close contact in the last 14 days with someone who's been diagnosed with COVID-19, and it gives a description of that. I have not traveled internationally or on a cruise ship. And I further affirm that if I answer yes to any of the above screening questions, I'm excluded from accessing the office. And it gives a number of days that you cannot access it. So this is our sample, and you can get this information off of our website if you're one of our members.
Ours is very similar.
Okay, and then Gary, our last slide.
Facilities lessons learned. In this time of uncertainty, questions will continue well after the pandemic. To reassure everyone, facilities leaders have established cleaning protocols based on CDC guidance, training their teams, documenting, tracking, and inspecting the work being done. Facilities leaders will continue to network with their peers and keep up to date on the ever-changing innovations and cleaning protocols with the goal of keeping everyone who visits their entities, buildings, and facilities safe. So essentially, facilities managers and their teams are first responders to all the buildings. Be well and be safe.
Okay. Thank you, Gary. I really appreciate your expert advice and opinion and sharing with us today. If you have any questions, you can always reach us through the City of Rochester Hills or me through the MMRMA. At this time, we have a couple minutes left. We'll take questions if somebody has any questions.
Okay, thank you, Terry and Gary, for sharing your expertise. Obviously, this is an incredibly complex topic since we actually did a little overtime here with our first session.